Thyroid disease currently impacts the lives of 30 million women. Many women who have thyroid disease do not even know that they have it. Despite your best efforts to communicate your symptoms to your doctor, you feel ignored and you keep receiving inferior testing and inadequate lifestyle assessment. The fact is that hypothyroidism is the most common autoimmune disease known today. It is estimated that 90% of the patients with thyroid-related disease in fact have an autoimmune disease. Despite this information, many doctors do not test for the condition known as Hashimoto's thyroiditis. In this case, the thyroid is a victim instead of the cause. Hashimoto's disease is the most common cause of hypothyroidism in the United States. It primarily affects middle-aged women, but also can occur in men and women of any age and in children. With proper treatment and guidance from a dedicated physician, hypothyroidism can be addressed naturally. Once the root cause is uncovered, thyroid disorders respond extremely well to strategic lifestyle and dietary changes. Let me help you uncover the underlying cause of your thyroid disorder and develop a plan to help you restore to your health and vitality. Hypothyroidism occurs when the thyroid gland has deteriorated due to poor nutrition, thyroid toxicity, poor lifestyle choices, stress, and overprescribed medicine. A victim of hypothyroidism has a body that can no longer adequately produce necessary hormones. Symptoms of the thyroid disease are abnormal TSH or other thyroid markers, hormone imbalances, sleep-related issues, lethargy, fatigue that is not relieved by rest, insomnia, night sweats, mental instability, brain fog, high cholesterol, constipation and other digestive issues, hair falling out, dry skin and hair, dry, cracked heels, nails that chip easily, thinning eyebrows, joint aches and pains, cravings for sugary foods, feeling cold all the time, unexplained weight gain, muscle aches and pains, heart racing or palpitations, depression, anxiety, altered mental cycles, inability to cope with stress, and many more. At Northeast Integrated Functional Health, we address your overall health, including your thyroid issues, with a comprehensive and personalized approach. We provide you with a plan, a program, and a promise to get to the root cause of your thyroid disease. Our approach will thoroughly evaluate the biological, chemical, and lifestyle factors that are connected to proper thyroid hormone metabolism. We provide functional testing to our patients to define the underlying cause of the problem instead of just focusing on symptoms. By really listening to you, we can determine the right test for your circumstances. We are able to offer you the chance to improve your health on your own terms. With a program that works for you, our objective is to work with you to develop an easy-to-follow, lifelong, drug-free strategy. I knew I wanted to become a doctor when I was very young. As a young person, I was impacted by my father and his deteriorating health. I could see that it was his lifestyle, combined with the inability to find high-quality healthcare that contributed to his poor health. I wanted to understand what was contributing to his illness. It didn't take me long to realize that traditional medicine was treating him for his symptoms, not for his condition. I wanted to practice true healthcare that would allow me to break with traditions and treat my patients, not treat them like a number. I spent my time listening to my patients, learning their lifestyle choices and preferences to make sure I can meet their needs, not leave them needing more. Drugs commonly prescribed by doctors can be addictive. So can repeat visits to the same doctor without achieving any results. I want to treat the cause of the disease, not the symptoms. I use unique tests to take this approach. As I am performing tests on more and more patients, I found that most of the patients that were visiting me are being overprescribed medicine that was making them sicker. The negative reaction to the medicine was part of their condition. I took everything I knew about functional neurology, functional endocrinology, functional blood chemistry analysis, science-based nutrition, and functional immunology, and began helping patients in a new way. Most doctors will not consider anything that falls outside traditional medicine as effective. These doctors fail to consider how diet, GI function, supplementation, and lifestyle alterations can bring greater function to their patients suffering from hypothyroidism. I have a very distinct philosophy about healing the body in a natural way. I have found that I can help Hashimoto's autoimmune hypothyroid patients naturally without dependence on dangerous and addictive medicine that often have debilitating side effects. To be successful in restoring good health to a broken body, an all-natural, functional approach is necessary. The body's immune system can act erratically and begin to attack the thyroid. You should avoid oral hormone measures. You may have been treated by a doctor or nutritionist because you were seeking relief from your thyroid symptoms. They may have given you some supplements that contained iodine, B vitamins, and thyroid glandulars to try to improve your thyroid function. If you swallow steroid hormones, you will seriously distort the intended result. When you swallow them, they will encounter potent stomach acids. The hormones that survive this assault then go to the liver, where they will be further broken down. Your liver screens all molecules that enter your bloodstream, passing some onward, modifying or detoxifying some, and rejecting others. Let me explain why thyroid replacement hormones as the single source of hypothyroid management is ineffective for so many women. If nature had intended to locate your hormone-producing ovaries in your stomach or somewhere else in your GI tract, it might make sense for women to swallow progesterone. If your ovaries were in your GI tract, your body would certainly have to be equipped with a way to process these hormones safely and effectively so that everything worked correctly. The most commonly prescribed supplements contained iodine, B vitamins, and thyroid glandulars to try to improve your thyroid function. There's a big problem with this medical prescription. Clinically, when a patient presents with an autoimmune thyroid pattern, neither nutritional support specific for the gland, thyroid glandular therapy, nor thyroid hormone replacement does very little to improve the individual's response and physiology. Remember, it is an autoimmune battle. We know this is an aggressive immune battle. If we make progress in that battle, you will begin to feel normal again. If we fail to consider and address the immune system, there will be no successful results. This treatment is ineffective. In Hashimoto's autoimmune thyroid, your body is literally destroying your thyroid tissue. And the longer you go without reversing the immune attack, the more thyroid cells you lose. Once they are gone, there is no way to get them back. Before I tell you about our natural approach to regulating the immune system, let's talk about the traditional treatment used in most autoimmune conditions. Whether you have been diagnosed with rheumatoid arthritis, lupus, or multiple sclerosis, the standard medical treatment is cortisone, other immune suppressing drugs, or thymectomy. In other words, complete immune system suppression. The approach is to suppress the immune system as an attempt to dampen the attack against the body's own tissue. Unfortunately, this treatment creates dangerous side effects. But to be totally honest, this is rarely used to treat Hashimoto's. In Hashimoto's, the usual treatment is no treatment at all. Most doctors look the other way and completely ignore the autoimmune attack against the thyroid. If you want to save yourself a laundry list of side effects from the immune suppressing drugs, you need to work with a doctor who is going to analyze your immune system with specific lab panels and make natural changes based on the specifics of your own immune physiology and lifestyle. It is terribly dangerous to suppress your entire immune system. Before we can begin to modulate or regulate the immune system, a very specific evaluation must be done. The immune system does more than just protect us from foreign invaders like bacteria, parasites, or viruses. It is involved in destroying our own cells to help us eliminate dead cells. This process is called cellular apoptosis, and if this system fails, cancer or other diseases can invade the body. The immune system has two sides, like a coin. The first side, called our T helper 1 system, Th1 system, is our immediate immune system response. It is responsible for an immediate attack against foreign invaders like microorganisms or parasites. The cells involved in the Th1 system are called macrophages, natural killer cells, and cytotoxic T cells. It is our frontline defense, the head of the coin. The other side of our immune coin is our T helper 2 system, Th2 system. It involves the production of antibodies to tag onto foreign invaders so our Th1 system can more easily find and destroy the attackers. It is our B cells that are responsible for producing the antibodies, the tail of the coin. Most of the time, our Th1 system will successfully destroy attackers before antibodies are ever produced. If the attacker is not destroyed by the Th1 system immediately, the Th2 antibody system gets involved and produces antibodies. These antibodies are like painting a target on the foreign attackers. It makes it extremely easy for the Th1 cell to find and kill the foreign invaders. In order for the various immune cells of the Th1 and Th2 systems to communicate and coordinate their function, they produce little messenger proteins called cytokines. In an autoimmune condition like Hashimoto's autoimmune thyroid, the two sides of the immune system coin become tarnished. It is this dysregulation in the immune system, the imbalance between the two Th systems, that tricks your body into attacking its own tissue. This dominance of one side of the immune system coin is also why the hormone replacement model as the sole thyroid treatment does not usually result in patients feeling better, even though lab tests may look normal for a time. All autoimmune thyroid victims' symptoms start with some sort of genetic susceptibility that links them to the disorder. At some point, the genes for the disease wake up and a destructive immune attack against thyroid tissue begins. Possible triggers that are known to wake up autoimmune attacks in general are hormonal imbalances, environmental compounds, heavy metals, pesticides, herbicides, etc. Stress factor, chemical, physical, and emotional. Antigen responses, bacteria, viruses, mold, and parasites. Food allergies and sensitivities. Any combination of these factors, along with some genetic susceptibility, can awaken the autoimmune response and will lead to the slow, gradual destruction of your thyroid cells by your own body. Once these genes wake up, we have no way of completely eliminating them. If these autoimmune genes wake up and activate, we can no longer suppress them, but we can modulate or regulate the immune system by implementing proper treatment. We begin with a comprehensive thyroid panel, including antibodies, to see exactly where your thyroid problem begins. There are over 30 different dysfunctional thyroid patterns, with autoimmune thyroid as the most common pattern seen in our patients. We are able to run laboratory panels to look for blood hormone imbalances, sugar disorders, anemia patterns, and adrenal gland dysfunction. All of these things play a crucial role in affecting normal thyroid function. So we go review your case carefully to uncover all the possible mechanisms that are contributing to how seriously ill you are feeling. When we are dealing with autoimmune thyroid, we go even further in our assessment. If necessary, we run a panel that looks at all of your lymphocytes, your white blood cell T cells, called a lymphocyte subpopulation analysis. This gives us insight into the health of your immune system. There are many reasons why we look at the two panels together. We have strategies and methods to help functionally manage the scenarios we observe. From the information we derive from these immune panels, we are going to develop an all-natural treatment plan to support your specific immune dysfunction. We use all-natural botanicals and plant extracts that have been shown in peer-reviewed scientific literature to have very specific immune stimulating and modulating regulating effects. There are many natural substances that have been studied which have immune stimulating or suppressing properties. But the key is the therapeutic use of those natural substances shown to have a specific effect when applied to a particular immune dysfunction pattern. One of the biggest mistakes I see natural medicine doctors making is giving autoimmune patients broad spectrum immune support. This may seem counterintuitive at first. If the immune system is unhealthy in an autoimmune patient, then providing things that are known to help boost the immune system should help, right? Unfortunately, no. It is totally different with autoimmune situations. Ideally, your Th1 and Th2 system would be balanced and working together. This is not the case in autoimmune attacks. The immune system is malfunctioning to the point that it thinks your own tissues are foreign invaders. It is absolutely critical that only botanicals and natural compounds that are known to have specific immune responses are used with an autoimmune case. This results in greater tissue destruction. We take this very seriously, which is why we must base our treatment off of the details contained in each individual's immune panels. Most alternative medicine-based patient management is not based on lab testing. At best, treatment in traditional natural medicine is based on old, outdated testing models like checking basal metabolic temperature, or even worse, solely based off patients' history. Rarely is proper lab testing even done. The results of these two panels can give us a clearer understanding of what the immune system dysfunction is. We are going to apply specific nutritional approaches to minimize the autoimmune attack against your thyroid. Using our understanding of functional immunology and understanding of natural plant botanicals and extracts, which have been shown to have specific desirable effects on the immune system, gives us the most highly effective strategies available to support your immune system. Most importantly, we can do this without all the side effects of immune suppressing drugs. Along with minimizing your autoimmune attack, long-term success necessitates that we remove any triggers that are flaring up your immune response. Triggers that may be involved include food sensitivities. We can identify food to which you are sensitive to your immune response every time you eat them, furthering the attack on your thyroid, leading to even further thyroid destruction. Iodine. Iodine can actually trigger a Hashimoto's response, even though iodine is a very important nutrient for thyroid function. And even though iodine deficiencies are very common in other parts of the world, iodine-containing supplements can be harmful. Iodine is a very important supplement for many people, but in supplement form, it may make the autoimmune against the thyroid worse. Birth control pills. Birth control pills have progressed over the years, but they are still a significant source of estrogen surges in the female body. It is a common scenario for some women to go on birth control pills and experience weight gain or get depressed. When they make the decision to get off the pill, they do not automatically lose weight or decrease their depression. Being on the pill in the first place may have triggered the Hashimoto's response against the thyroid. Hormone imbalances. This is especially true when looking at estrogens in pregnancy. During the third trimester of pregnancy, a female is Th2 dominant. And in the case of postpartum, they can have a tendency to be Th1 dominant. This fluctuation of hormones is enough to awaken the Hashimoto's response for some women. It is very common to have a woman deliver her baby and then, months later, be diagnosed with hypothyroidism. Actually, it was Hashimoto's that awakened after pregnancy. The third issue with estrogen and Hashimoto's is perimenopause. As women lose their feedback loop between the pituitary and ovaries, which happens as a consequence of normal aging, there are surges of estrogen because the pituitary can no longer regulate the ovaries. These surges of estrogen can wake up the Hashimoto's response. When these estrogen surges occur, they may trigger an increased autoimmune attack against the thyroid, causing thyroid cells to be destroyed. The estrogen surges promote and further increase the autoimmune thyroid destruction. This increased destruction of the thyroid will result in short-term, high release of the thyroid hormones into the bloodstream, creating temporarily high thyroid hormone levels. This increases the metabolic rate, and women may experience hot flashes, sleeplessness, and irritability. Most women consider that these symptoms are attributed to a deficiency of estrogen from going through menopause, but often that's not the case. It may be the estrogen fluctuations that are causing the physical symptoms and irritability, but rather it is the immune attack against the thyroid that is promoted by the estrogen fluctuations from the menopause process that creates a temporary hypothyroid response. Whenever we see a postmenopausal woman who developed her hot flashes, sleeplessness, and irritability, that does not resolve with estrogen replacement therapy. We know we are likely dealing with a Hashimoto's response that awakened with menopause. In these cases, many times we can totally normalize the hot flashes by treating the autoimmune thyroid. Insulin surges. Surges in insulin really promote the autoimmune attack on the thyroid. The insulin surges actually stimulate the immune cytokines responsible for your autoimmune attack. Insulin surges occur in diabetics, prediabetics, and hypoglycemics. The total number of functional hypoglycemics and insulin-resistant people walking around is staggering. Many people get checked by their medical doctor and are told they are healthy. I'm going to tell you right now, even if you were told your labs were normal, the lab ranges they use are not healthy functional ranges. There is a good chance there's an underlying blood sugar problem. We are going to test for this and look at functional markers, which are going to let us know what is really happening. There are many harmful effects of altered blood sugar patterns. We must deal specifically with these things, or the body will continue to promote an autoimmune attack against the thyroid. Hypercortisolism. Cortisol is your body's stress hormone. It is produced when your body's energy demands increase as a result of stress. When there's an active stress response from chemical, physical, or emotional stresses, or a defect in your brain's ability to modulate stress, you will have increased cortisol production. The increased cortisol promotes insulin resistance, and therefore insulin surges to compensate for the resistance. This will cause your autoimmune attack to get worse. Gastrointestinal infections. There are a number of GI infections that promote the autoimmune response. Your gut has a number of healthy bacteria that live and actually produce positive benefits for normal functioning. When the balance between good and bad bacteria is skewed, called dysbiosis, it can promote autoimmune inflammatory responses. We do lab testing to reevaluate the health of the GI system. If we ignore this, our chances of fixing your autoimmune thyroid condition is greatly compromised. There is no single approach to dealing with autoimmune thyroid. Until we look at all the triggers that cause and promote the autoimmune attack, systematically work at removing these triggers and then reviewing your immune system with the lab panels, there is no way to know what is going on deep inside your body and how to deal with the specific issues. We deal with these problems every day, and we are very good at using natural treatments to help you begin to feel like you used to. That probably sounds like a lot of tests, doesn't it? Well, it is. I know you may have already had a litany list of tests, but I will guarantee you have not had these. And even if you had some of these tests done, the doctor who ordered them most likely did not know how to interpret the results or what to do with the information. We know your previous doctors had your best interest in mind, but the awful truth is the state of hurry-up healthcare today. Not everyone needs every test. We do one of the most thorough and extensive case reviews you have ever experienced, from your history, current presentation, and initial consultation. We work with each individual to determine what is needed. It is truly an individualized approach. So you are probably wondering, this makes sense. Why doesn't everybody do it this way? Many doctors are seriously behind the times, living in the 1940s, 50s, and 60s. They are using outdated treatment models, which does not work for the majority of people in our modern environment. They may not understand how to use natural supplementation and nutrition. The second reason is that they and the insurance companies do not consider these comprehensive approach and testing medically necessary. These tests should be approved, including everything that is going to contribute to having a better functioning body and that will help you feel as good as you possibly can. We help our patients start to feel better because we are thorough and look for the right things. We do not cut corners. This is your health on the line. Every day I hear patients desperate because of the fatigue, constant weight gain, hair loss, depression, and frustration. And I listen to them rejoice when they finally understand how they can find relief. The goal of the case review, consultation, and any initial testing is to tell us what your functional imbalances are, what your immune system dominance is, and what triggers and lifestyle factors are contributing to your problem. Then we can design an all-natural, step-by-step approach to helping you achieve your desired results. We will create a treatment program that is going to support the abnormal physiological shifts we measured with our testing. It is necessary to address these functional immune, hormone, and metabolic imbalances in the proper sequence. We look at everything we need to do up front so we know what sequence we have to take to help you. As you enter the program, we will need to complete a series of tests before we can treat your illness. We have lab tests to guide us so you can start feeling better. We will confirm that things are changing in the right direction. Based on your specific case, we are going to have a schedule of your retest so we can make a correction and know when we need to move on to the next thing. Sometimes we cannot effectively support a particular physiological process until we normalize another first. A lot of doctors will not do this for you. Many natural medicines are based off of no testing at all, minimal testing, or the wrong testing. Mainstream medicine is going to force hormones and antidepressants on you no matter what the labs say. So there's not a lot of testing done on that end either. Functional changes take time. Remember, our job is not to give you a pill and send you away. Our job is to take a step back, look at the big picture, and systematically support your physiology. The reason you may not have gotten help yet is because no one dug deep enough, was prepared to listen, understood your problem, were able to take the time necessary to make the changes. If you are sitting here listening to this message, you know that your current approach to improving your thyroid health and addressing the problem is not what you want. You know you are on the wrong track. You deserve to have a doctor who listens to you, who understands you, who is willing to do whatever it takes to work with you and help you. What matters is that you are still suffering needlessly, and you have been suffering too long. You need someone who is going to treat your condition correctly and help you. The number one factor that determines success or failure with a case is how closely the patient follows my recommendations. If you do the things I prescribe, then you are going to go down the road you have been wanting, probably for a long time, which is moving towards normal again. You want to take control of your health and do what it takes to help you get your body well. Nothing else matters when your health starts to deteriorate. Because you are willing to learn and change your circumstances, I want to work with patients like you. Our initial review of your case, consultation, and examination is $997. But if you schedule your case review within 2 weeks of requesting this report, it is only $50. As I explained, our unique approach is different than anything in this area. Our proprietary program will identify the specifics of your case, what tests we need to run, and how long we anticipate it taking to make the functional changes we need to return you to the healthy life you deserve. My job is to work with you, to help you improve your health and reverse your present condition. My job is to deal with all the specifics of your case, listen to you, and work together to make proper functional changes. Everything can be done in steps. The first steps involves a case review, examination, and consultation, so we can get to the specifics of your case. There's always a way to make it work out financially. We have financing options available through our office, as well as many different payment options to help minimize your immediate out-of-pocket expense and limit the impact on your financial situation. We can make it work. Your main concern should be getting well and feeling better again. You have the rest of your life in this body, and you can be energetic and healthy enough to enjoy it, or you can suffer with fatigue, depression, weight gain, and hair loss. The smartest choice is to get the cause of the problem and not get passed through the medical system, being treated like you do not know what you're talking about or feeling. Ask yourself if you can afford not to get treated. If you are honest with yourself, the answer is no. The thyroid hormone replacement is making up for decreased internal thyroid production, but it does not address your immune problem. Immune suppressing drugs are going to create long-term side effects and greater problems in the future. Natural support for the thyroid gland itself is often futile for autoimmune Hashimoto's thyroid. You don't want to continue feeling like you do now. You want to be one of the fortunate few who receive the proper support and treatment and live well. That's where we come in. What is included in the initial consultation? A consultation with the doctor to discuss your lifestyle, problems, and concerns. A complete case history and health questionnaire. A complete analysis of dietary habits. A dietary nutritional evaluation. A physical examination. We will also review your medical records and lab tests, if available, and we are going to go over them carefully, leaving nothing out. We are going to determine whether you've had the appropriate test ordered and make a decision of what further testing is required. Finally, implementation of any immediate beneficial changes that are necessary based off of previous labs in your medical history. If you want this to be the last day of feeling sick and tired, and you're ready for a comprehensive, natural, and functional treatment approach to change your current thyroid treatment, then call us at 412-342-8433 and schedule your complete thyroid health review and consultation. Or just click here to schedule online now. We will get you scheduled and send you a new patient medical health questionnaire. The $997 costs only $50 if you schedule within 2 weeks of requesting this report. For the initial consultation, we'll cover the review of your medical history, review of past medical records, review of recent labs, our consultation and recommendations, and examination. This is your time to change your condition. Do not continue to feel the effect of your illness for another day when the potential answer to your illness is one informational appointment away. Make the healthy choice now and don't regret another day of your body and health disconnection. Click here to schedule your appointment now. You are worth it. Yours in health, Dr. Emil Nardoni.